Um, Welcome everybody. It's December 23rd. My name is Tim Desmond. And in this training, we're going to be talking about addiction, trauma, and possibly get into psychosis. I'm not sure how much we're going to get through in an hour. The reason that I want to bring up these three kind of pretty different situations is that they all kind of require they all can, if you're working with somebody with addiction, trauma, or psychosis, there's some information that can be really helpful to have to be able to be more helpful in your interaction with them as a peer counselor. So this is Tim Desmond from Peer Collective, and we're talking about doing peer counseling for addiction, trauma, and psychosis. And we'll see how much we get through, and we might continue this in a few days. So our overview, the main ideas for talking about addiction, I'm going to talk about the difference between an abstinence model and a harm reduction model. And then we're going to really get into motivational interviewing and stages of change, because these are probably the most important ideas for being able to effectively offer peer counseling to someone dealing with addiction. Then we're going to talk about trauma. We're going to talk about when we talk about trauma, how trauma is stored in the body. It's stored differently than a lot of other emotional pain. The idea of hyperarousal, sort of like when sometimes what's being called basically being triggered. So when a trauma is triggered, it has a specific kind of reaction in the body, and it changes sort of what's helpful in that moment. We'll talk about that. And sort of tools for the idea, titrating is a term that's sometimes used in trauma therapy. And it's basically about how much of the trauma can we talk about before this person goes into a triggered kind of hyperarousal state, right? You want to be able to talk about it, but you don't want it to be so vivid that the person goes back into this kind of really triggered state where you're not actually able to be helpful anymore. So we'll talk about that. We'll talk about how trauma, sort of like a model or of how kind of caring accompaniment, how peer counseling can be helpful with trauma. And then the idea of post-traumatic growth. The idea that the difference between, is trauma something that you just recover from and you try to kind of get back to where you were? Or can traumatic experiences actually be something that ultimately strengthens us and helps us to grow? So that's another thing. And then if we get into, we'll get into it this time or next time, if we get into psychosis as well in this hour, sort of just understanding psychosis, because a lot of people get kind of weirded out about it. So just normalizing psychosis, understanding that it's possible for people to learn what their triggers are for having a psychotic break, and then talking about all of the different paths, because people react and sort of, especially after you've had your first psychotic break or after you've had several psychotic breaks, in terms of being able to learn how to move forward, people take a lot of different paths and kind of making space for that individuality. So, and let me see, I want to make sure that we can get back into, I'm going to open up chat as well. And so if anybody has any questions, then you can just put them on our group chat for everybody who's here in the Zoom meeting with us. So let's start with addiction. The first thing that I want to talk about with addiction is the difference between an abstinence model and a harm reduction model. So, and let me just change this a little bit so we can hopefully see a little better. And then is there a way that we can make it so that you can see me? Nope. All right, so I'm just gonna get rid of my face for a minute so you can see the slide, and then we'll pop back up. So an abstinence model. The main difference between abstinence and harm reduction is that in the abstinence model, it's the idea that to be in treatment, you must be sober. And an example of the abstinence model is 12-step, for example, AA. You're not like a precondition to joining AA, coming to AA, is that you're at least trying to stop drinking. And you are not supposed to go to AA if all you're trying to do is reduce the amount that you're drinking. That sobriety is part of wanting to join AA. Harm reduction is different. Harm reduction is the idea that we assess the person's individual goals and we try to reduce harm in any way possible. So for example, one example of harm reduction would be if you're talking with someone who's an IV drug user and you talk with them and they're like, yeah, I'm not trying to quit. You know, I feel like I have it under control. It's, I'm worried about disease, but I actually feel like it's something that I don't want to stop right now. So then the question is, so a harm reduction model would be something like discussing finding clean needles and creating a plan. If you're in a place where you're wanting to use and you don't have a clean needle, how can you make a plan to avoid sharing needles? So the idea of harm reduction is basically like, not everyone is going to stop their addiction. And there are going to be people that you're going to have a chance to talk with who aren't in a place right now of wanting to stop their addiction, or even consider it an addiction. And so is it possible to reduce harm? So for Peer Collective, the idea here is that we can still help someone who isn't ready to stop their addiction. You don't need the caller, the user. We don't need them to be ready to stop drinking, to stop using, in order to be able to be a helpful presence in their life. And really, just being a caring human being is like the most basic way of being a helpful presence in someone's life. And maybe there's more. Maybe there's other sort of harm reduction types of conversations that you can have. Or maybe you can just be kind of giving somebody space and being a sounding board as they're contemplating. Do I want to, like, do I feel like I have an addiction? Do I want to change my behavior or do I not? And just like being there for them in that place can be extremely helpful. So in Peer Collective, so one thing that we might want to be clear about is, as a Peer Collective counselor, if you are not comfortable talking with somebody who is actively drinking or actively using drugs, then that might be something to add to your bio. Just like, just kind of like giving people a heads up, like if you're that's, and we could sort of talk about specifically how to phrase that, but it's fine if you're talking with someone who is obviously addicted to a substance and they're not ready to give it up. It's fine for you to sort of decide like, yeah, that's not the right match for me. I don't think I can help that person because I'm not going to feel comfortable. Like it's going to be really hard for me not to be wanting to tell them, you're an addict, you should stop. But the thing that I want to go over right now is that's not likely going to be what's going to be a help for them to say that. And so we want to be aware of like, okay, so maybe I'm not going to be the right match for this person. So we can get into that in terms of like individually, but but the general message is to be aware, if you can sort of tolerate being present with someone who maybe isn't ready to change their behavior. Can you actually be there and try to support them in whatever way that they need support in that moment? So, and again, I'm going to make sure that the chat is open in case people are wanting to add anything to that. So I want to go, so this is something that we went over in a previous training, but it's really, really important when it comes to working with addiction, and that is stages of change. So if I'm talking with somebody who is in the peer collective video assessment, there's someone who's saying, my wife's really upset about my drinking. And she doesn't know that I use Coke at work, but it's not a problem. You know, I'm totally can handle it. We would call that pre-contemplation. Now, this is not even like in this slide, it says, I know I feel bad, but I'm not thinking about changing anything. It might be like, so for just to be talking to you, there's some type of a problem. So it's like, yeah, it's just like, they might view it as like, my relationship, you know, my wife is just really complaining at me and I need some empathy for that. I'm looking for empathy because my wife doesn't understand me. It's not that I have a problem. My problem is that my wife is criticizing me. The drug use is not my problem. So that would be pre-contemplation because I'm not even considering changing my behavior. Now, as we say on the bottom of the slide, some people will shift during a session because in reality, I might be saying that to you. And the clearest way to say it is there might be a part of me that's not even thinking about changing my behavior. And there might be another part of me, even in that same moment, that is in the contemplation stage, which is there's a part of me that kind of knows this isn't working and most likely, you know, it's ultimately not going to be good for me. You know, like that the way that I'm drinking and using drugs isn't ultimately good for me, or I'm at least thinking about, is it good for me or not? You know, I'm not like getting ready to change yet, but I'm thinking about it. But I don't know you well enough to be able to be vulnerable in that way. So I'm just presenting as pre-contemplation. I'm just presenting as, I have other problems I want to talk about, and drinking and drugs are not something that I consider a problem. If I don't consider my drinking and drug use a problem, and you tell me that it is, then we have a very basic failure of alliance. We are not on the same team. We are not allies. I have my goals and you have different goals, and it's very unlikely that counseling is going to be helpful. Contemplation. I'm thinking about making a change, but I'm not ready to act, which is basically sort of like, okay, is my drinking a problem? And if you try, and if I'm coming into the session saying, is my drinking a problem? Like, should I try to cut back? Maybe am I an addict? Should I maybe try 12-step? And I'm just trying to figure it out. And you respond to me as though I was ready to act with like, hey, let's do this. Or here's what I think you should do. Then most likely, I'm not going to really feel like you get me, like we're in the same place, because like I might try to meet you there a little bit, but I'm not really going to feel understood, because what I'm interested in trying to do is trying to explore, is a change needed? And if so, what kind of change might help? Eventually, I decide that a change is needed. And that's when I'm in the action phase. And maybe I already know what the change is, and I need support implementing it. Or maybe I know I need a change and I need your support figuring out what it is. So that's a different mode for me to be in. And then finally in maintenance, you know, I'd stopped all drinking and drug use for 2 years. And then I went through a really bad breakup and I started using again. And I'm just like, yeah, it's just been a couple months, but I already see it kind of getting out of control. So in maintenance, one of the things that you're really going to be interested in was, what was working for you before? How did you succeed in stopping before? And then and then looking at like, how could we replicate that now instead of having to reinvent the wheel? So this might be a moment if there are any sort of questions or thoughts, just as we go through this in this training, if anybody has questions or thoughts, if you're watching this on YouTube, you can post them in the comment section. You can email me if you have my contact. If someone is active in this training in the Zoom room, please feel free to just type into the chat. So motivational interviewing is I believe is a really helpful and a really popular tool that people use in working with addiction, and it can be helpful in working with basically anything in peer counseling. The idea is in motivational interviewing is that the way that I think about it is that in motivational interviewing, I'm allowed to just accept people for who they are. In motivational interviewing, I'm not responsible to figure out what's wrong with you and convince you to change it. That is not my job description. And I believe as a peer counselor, that should not be your job description. In motivational interviewing, what we're trying to, that your job description is, so my job is just to accept you, care about you, love you. And part of accepting you is accepting, understanding, and aligning myself with some part of you that wants a change. So let's say you come to me and what your motivation, you're motivated to stop drinking. You're also really scared about stopping drinking and you don't know what it's going to be like and you're scared of failing. But the reason that you've reached out to me, if we really ask, like, so why did you pick up the phone? Why did you get on this website and book a session with me? The reason that you reached out at all was something, you wanted something different. You wanted some help in some way. And with this person, it could be they want to stop drinking. They know that they want that, but they're worried about how to do it. Their motivation, someone else might call in and say, okay, I've had 3 DUIs in the past year and a half, and I'm ready to lose my license for 5 years. Whatever state you're in, laws are different, but I need to stop getting DUIs. And you say, okay, so are you, do you feel like you might have a drinking problem? Is that sort of like something that you want to talk about? And they're like, no, I'm not interested in, I'm not an addict. I'm not an alcoholic. I just need help figuring out how to not to get another DUI and get that under control. That's my motivation. If you believe that I should stop drinking, and I believe I just need to stop getting DUIs, we have a failure of alliance. You want me to be a different person than I am. And so counseling is not likely to be helpful. So then the question is, can you just join with me in saying, well, let me see if I can help you to stop getting DUIs, and let's figure out what that would take. Next person. Yeah, I'm my partner doesn't know that I'm using cocaine, but the finances, it's having a big impact on our finances, and we have a lot of relationship conflict. And I'm like, and when you ask me, like, so what is it that I want to change? It's just like, yeah, I really don't want to lose this relationship, right? I'm not saying that I want to stop using cocaine. In fact, ideally, I would like to figure out how to not lose the relationship and get to use all the cocaine I want. That might not be possible. And so the idea in terms of motivational interviewing is that you want to say, like, okay, if I'm being honest as your peer counselor, I'd be happy if you cut down on the cocaine. Like but that's me. But the thing is, like, that's me not really accepting you, not really letting you be the person that you are. Because the real human being that you are is someone who really wants to keep your relationship And maybe there is a part of you that wants to stop using cocaine, but there's also another part of you that doesn't. And if I can accept all of you, that complexity, then the clear thing is, okay, well, let's see what it would take for you to, not lose this relationship. Like, let's look at what's threatening the relationship and see what's going to be necessary to keep it. And the same thing is like reducing other people criticizing me. It might be that what actually is motivating me, the real thing that I want to be different, is for people to stop being mad at me. Like, that's what I want. And the reason that they're mad at me is whatever substance, whatever behaviors that are a result of my substance use. But the part that actually makes it feel unlivable for me is that people are mad at me all the time. And that's what I want to change. And maybe when we start to looking into that, if you can join with me and say, okay, I don't want people to be mad at you all the time either. Let's look at, what it would take for the people in your life for those relationships to be better. You might find that changing your substance use patterns is going to be a part of improving those relationships, but it's in the service of something that matters to me, which is not getting criticized all the time. And if that's what's driving it, so the idea is that we join with that motivation and don't bring your own desire to change the person. Your job is to accept them and be there for them. And part of accepting them is accepting that there's a part of them that wants something to change. You join with that. Let their own motivation be the engine that drives whatever behavioral change, not you. Not that you want them to change. So let's do, so I want to get into maybe some kind of role plays and look at this a little bit, because I feel like this is worth digging into. So let's look at everybody here, and yeah, let's either through chat, or how about I'll ask for sort of a volunteer. I'm going to role play a Peer Collective user, and I'm going to be someone who I like you get a message saying, I think that my drinking might be out of control and I want to talk with someone about it. Who wants to take that call? And you can just you can either volunteer over chat, or you can just unmute yourself and say volunteer. And I'm happy for anybody who's here who wants to try. And feel free to just to hop right in. And what we're going to be practicing, just to be clear, is this sort of motivational interviewing. You're gonna try to, I'm going to talk with you about what's motivating me, and you're going to try to just basically join with my motivation, with what feels important to me. Hey, oh, Divine, I'm sorry. Hi, Divine.
Hi.
So you get a message from a user, and when they book the session, what they say is that I think that my drinking might be out of control and I want to talk with someone.
Okay, let's do it.
Okay. Hi. So what I wanted to talk about is a lot of people have been telling me that I drink too much, and
Okay.
I don't think that I do. I think that I have it under control. But I just wanted to talk with somebody about it, and just sort of like, maybe you can tell me if you think I have a problem.
Okay. So why don't you tell me some of the things that people are saying to you that are
Mhm.
making you feel uncomfortable?
Oh, great. Yeah, thank you. Um, so I've been dating this woman kind of on and off for a couple years, and every time she breaks up with me, she tells me that I'm an alcoholic and I need to get treatment. Um, my parents say that I've had a hard time, at work. Like I have a lot of conflict with my boss,
Mm.
and my parents say that it's because I drink too much, and I just kind of feel like you know it's like everybody drinks, and so um, I don't know. It's like hard for me to feel like it's like it really a problem.
Okay. So, why do you think you have conflicts with your boss? And, or you can tell me, why do you think you are having trouble with your relationship? What do you think is
Wow.
causing it if it's not the
Yeah.
drinking?
Well, with my boss, I mean, it is that it's like sometimes I come into work hungover, and that's probably maybe
Okay.
what I need to do
Hmm.
is figure out how not to. Maybe I just need to like make it so that people don't kind of notice how much I'm drinking, or I don't know,
Okay.
like I shouldn't go into work hungover. That's probably true. I
Okay.
mean, he's kind of a dick anyway, but
Okay. All right. Well, what days do you work? Maybe we can talk about
yeah,
not drinking on the nights before you work, or a cutoff time so that you're not as hungover when you get to work.
yeah,
Is that something you're interested in?
yeah. Okay, so I want to pause. Divine, thank you. That was perfect.
Okay.
So yeah, I feel like that's like sort of like a perfect example of kind of what I'm talking about in terms of joining with their motivation and not assume like it's probably pretty clear to everybody that the person that I was role playing has a drinking problem, and that my life might be better if I were a little more serious about it. But like I felt like Divine that you were trying to help me with what I wanted. And I sort of had that, like, what I was feeling as I was role playing that person was like that I could sort of trust to be a little more vulnerable with you. Like, I was starting to be like, well, actually, I did try that and it was hard, um, like having tried and failed doing that. And I was like, but I wouldn't have been able to go there if I felt sort of judged by you. And so I really want to say like that was a great example.
Okay, thanks.
Yeah, thank you. Um, yeah, so I feel like now, yeah, so I feel like that's just a really great example. And let's take are there any, does anybody have any questions, or does anyone have another example of a kind of person or a situation? Because I know we've all been around people with various substance issues. Um, does anybody have another person or another example that they're curious about that they're not really sure how to handle? Because I could yeah, I'm curious. I could you know respond to those questions. But if nothing comes up, you can please feel free to post in the comments if you do have questions, and I can respond there. Um, but if not, I'm gonna come back to our presentation. Um, and we'll go into trauma. So trauma is, I'm going to see if I can do this. Is that going to work? No. So the most common definition of what is trauma is trauma happens when we have an experience that we believe is life threatening. It may or may not be, and that actually doesn't matter. We subjectively believe that the experience is life threatening. Because what happens when something feels like it's life or death, your brain and body process things differently, in a qualitatively different way than other experiences. So when I was just talking about the stages of change, pre-contemplation, contemplation, action, and maintenance, the way that that information was stored in your brain, hopefully, was in this sort of like in your prefrontal cortex in the front part of your brain as kind of intellectual knowledge. When something happens to you that's life-threatening, the memory is stored differently. It's stored more like a reflex, because what we're kind of evolved to do is when something is life-threatening, we don't want to have to stop and think before we act. We want to be able to just react without any thought. And so in many ways, from sort of an evolutionary perspective, storing trauma in a way that creates a sort of a reflex reaction with no thinking might save your life. And a lot of people who talk about therapy with trauma, one of the ways that they talk about it is that, so for example, if you were a hunter-gatherer living in the forest, and like thousands and thousands of years ago, like 50,000 years ago, you're living in the forest and you hear a rustle in the bushes, and then out jumps a saber-toothed tiger. Well, if you don't die, if you make it through that, anytime you hear a rustling in the bushes that's anything like that, the saber-toothed tiger one, you are going to be running before you're asking yourself why. And that actually makes sense. You're more likely to live. You'll live a lot longer with that kind of reaction. So that's how trauma is stored in the body. Now, because of this, offering peer counseling for people who've experienced trauma is more difficult and complicated, because a traumatic reaction happens in a way that's pretty different than a normal type of reaction. That when trauma is triggered, the person will have a full body reaction and they usually won't know why. So what happens is, the way that we often talk about it is that the part of our brain that does a lot of our kind of intellectual thinking is the sort of what we call the prefrontal cortex, the front of the brain. And that's the part that allows you to stop and think and reflect and kind of ask yourself why. It's the sort of slow, thoughtful part of your brain. And in a sort of a traumatic state, that part of your brain is turned off. It's basically offline, and you can see this in brain imaging. And what's happening is all of the deeper stuff that's like closer to your spinal column is kind of taken over, like the more kind of reflexive, deeper brain that's just going to be, that's specializes in reacting. So sorry about that, everybody. My connection went out, but I'm back. So let's see, go back to share. So as I was saying, so the core takeaway here is that that trauma has a way of creating this triggered state that where we process information differently, and it's kind of qualitatively different than other types of issues. Now, when we talk about dealing with trauma and talking with people about trauma, it's helpful to have sort of a sense of the difference between acute trauma and chronic trauma. And it sort of exists on a spectrum. So the far side towards acute trauma is something that happened once, right? So an example, like the biggest example of acute trauma would be everything in your life was going well, and then you had a terrible car crash. And then since the car crash, things have been fine in your life. You have this one traumatic experience that you're terrified of driving, you're terrified of cars, you're having a traumatic reaction, but you have a lot of other resources to draw on, and the rest of your life has been pretty supportive. So that's a much sort of simpler and more straightforward way of, coping with trauma. On the far other end, we would call this chronic trauma. And like an example of chronic trauma, you might actually talk with people. There are people that you might talk with that from the time they were very young, every important attachment figure has abused them. And not only were they abused over and over again by various people when they were young, but then as an adult, they've just gone from abusive relationship to abusive relationship, and sort of never had an experience of a safe, close relationship. So it's sort of like, in one hand, you have someone where 99% of their life was pretty supportive, and you just have this one trauma. And on the other hand, you might have somebody where 99% of their life was kind of traumatic, was abusive. So when you're dealing, and then obviously there's a lot of space in between. People who had like an abusive childhood but a more supportive adulthood, or different things like that. So when you're dealing with somebody who has really chronic trauma, often the best thing that we can offer them is our presence, our willingness to be there. It is being that one person in their life that cares and isn't, taking advantage of them. And just being, now, if someone has that degree of pain, it can take a lot. It's actually asking a lot of ourselves for us to be open and present with someone who's in that much pain. But if we can do it, it's a real gift. So just kind of having a sense, whereas someone with more acute trauma, it's a little easier just to sort of look at, okay, well, your life has generally been safe, but there's this one dangerous thing that happened. And so can we kind of, sort of recovering back into safety is a little bit more of like, there's more of a goal of trying to let go of that trauma. Now, when we talk about peer counseling with someone with trauma, one of the things that we want to be really aware of when we're talking with someone, especially talking with someone about their trauma, there's the idea that's usually called in trauma therapy hyperarousal. It just means being triggered. The idea is that if I'm telling you about a traumatic experience, as I'm talking about it, what might happen is my heart rate starts to go up, my blood pressure starts to go up, like my body is starting to have this fight or flight kind of reaction in it. And then I cross a threshold in my body in terms of like my level of agitation and sort of being triggered, to the point that I'm in a hyper arousal state. I'm in a fight or flight kind of moment. And the main thing is my prefrontal cortex isn't online anymore. Nothing that you can say to me if I'm in this triggered state is going to be helpful, because I'm in reaction mode. I started by just trying to tell you the story of what happened to me, but in telling it, my body said, oh, wait, we're reacting to that now? It's like going back to, the caveman, who got attacked by a saber-toothed tiger, if I'm telling you about the time that the saber-toothed tiger jumped out, just as I'm telling you about that story, my body might start having a reaction like it's getting ready to run from the tiger. Once my body is having that reaction, I'm not processing things anymore. There is no processing possible once I'm in that level of reaction. And so the other word that's up here is titrating. Titrating means bringing up the trauma just enough that you can talk about it without getting overwhelmed by it, right? So then the issue is, if you're asking me, so tell me about what happened with the tiger, if I go into a lot of details, that might be too much for me. And I might start getting sort of flashbacks, or my body might start having this reaction. But if I just sort of talk about it indirectly, like there might be ways of that I can talk about it that isn't so vivid, that I can approach it and kind of make sure that I'm approaching it in a way that isn't bringing it up too strongly. Now, if I get into a place that I did talk about it too vividly, and I'm in this kind of reaction place, there are a handful of tools that will kind of help bring me back out of it. And probably the easiest ones to do are feel your feet on the floor, feel your body in the chair, name 3 things in the room. Okay, I look around, there's a lamp, there's a computer, there's a mug. And that's one way of bringing me back into the present moment. Feel your feet on the floor, feel your body in the chair, name 3 things in the room. Now tell me how's your body feeling now? Did it your heart rate, your respiration rate, has it kind of gone down a little bit? Do you feel like you can talk again? But again, the next time that we want to talk about it, it might make sense to sort of talk about something else for a little while. It might make sense to sort of talk about that traumatic experience in a more indirect way. But if we're going to be listening to people talking about their traumas, we want to be really aware that when someone gets triggered into a state of hyperarousal, when my body is ready to run for its life, I'm not processing things anymore. As soon as my body is ready to run, there's no more processing happening. You have to bring me back into the present. And an easy way to do that is feet on the floor, body in the chair, name 3 things in a room. Another thing, a tool that I often use is, and this is something that I would always do before discussing anything that even potentially could be traumatic, because we kind of try it out. We'll try this here. What I'll do is, okay, so before we kind of talk about that, I wanna try a couple of exercises to see if they might be helpful in case things get kind of intense while we're talking about your story. So one thing that might be helpful is, can you picture someone? It might be someone you've known, it might be a religious figure, it might be an animal, like whatever. Can you picture someone or something, some being that you feel like fully accepts you and that you feel like fully like understood and accepted and supported or cared for by, or maybe a being that where you feel really safe, whatever feels better. Maybe a place that you feel safe. And we sort of look for either, it might be an animal or a person, it might be a religious figure, it might be a place where someone feels cared for and safe. And then we just sort of practice. So picture yourself there, or picture yourself, so maybe it's your dog, picture yourself holding your dog. Picture yourself, in your bedroom, or, whatever it is, whatever the safe place or safe being is. and just stay there for a few minutes and just really let yourself feel that safety, feel that care. And then if someone is triggered later, we can kind of go back. Okay, so now, and then I know what works for the person. So you start telling me your story about the tiger, and I say, okay, so can we go back and picture yourself holding your cat? You know, you're in your chair in your living room and you're holding your cat. Let's go back there. And then that can really help somebody kind of move back into the present, move, you know, get out of that triggered state. And then the last part that I want to talk about in terms of trauma for now, and I think this is probably what we're going to get through because I want to look at some examples, is the idea of post-traumatic growth. So one of the things that I think is really important to understand about trauma is that when we think about any positive quality, anything that you like about yourself, especially anything that you would think about yourself that you would think of as a virtue, like your patience, your compassion, generosity. So many of these qualities we develop through suffering, through having suffered. We develop patience through, we develop compassion, we develop a lot of what we like about ourselves. But I think especially compassion, we develop through having suffered, having experienced pain in our lives and being able to relate to people because we have had pain. And so sometimes when we think about trauma, if we're thinking about trauma as like the goal, like my goal in trying to process or deal with this trauma is sort of like to erase it from me as though it never happened. That's hard because it did happen. But there's a difference to being able to change it from something that happened to me and is now debilitating to something that happened to me and makes me stronger. And that's what we call post-traumatic growth. And when we talk about post-traumatic growth, one of the most important things, the difference is, what does the trauma mean about you and about the world? Because the difference between a trauma that is debilitating and a trauma that makes me stronger often comes down to the meaning that I attribute to the trauma. Does it mean that I live in a fundamentally unsafe world where I could be attacked at any moment? Does it mean that there's something wrong with me? Or, because those kinds of meanings that I'm saying, like, this trauma happened because, or what this trauma means is, those kinds of meanings are going to make the trauma debilitating. But if I'm able to shift that meaning to something like, what this means is there are real dangers in the world and I know how to deal with them. Or, some people are safe and some people aren't, and I know how to tell the difference. That is, and I know what it feels like to trust an untrustworthy person, and I can relate to someone and help people that have done that. That's the type of meaning that's going to sort of make something, make it more like post-traumatic growth, make it a source of strength and growth. So what I want to do now is, kind of coming back to our group. We just have a couple more minutes left. I think the first thing that I want to do is, are there questions about trauma? This is in our next training, I'm going to go in more detail. We're going to look at more kind of examples of trauma, and then we'll get into psychosis as well. But just as I'm sort of bringing up these ideas, if there are any questions, please bring them up on the chat. And if you have any examples of, like, so how do I handle this type of situation? please feel free to bring it up on the chat or to unmute yourself, and we can sort of look at specific cases. Yeah, so deep breathing. In terms of when someone's getting triggered, deep breathing can be something that helps. In my experience, feeling sensations in your body and naming things in the room are often, sometimes if someone is kind of hyperventilating a little bit, um, deep breathing doesn't always calm them, but it totally can. It's more about one of those things where I feel like if someone is kind of in that triggered state, let's say 80% of people will feel better with deep breathing, but like 95% of people will feel better if you ask them to feel themselves in the chair and name things in the room. So I just try to, in that small percentage of people that might feel like they're hyperventilating when they're trying to breathe. That's the one reason that I wouldn't do that. But it's great to have like sort of, you can try things and be like, and just sort of check in, like, is this making you feel better? We can try something else. Chantel, did you have something you wanted to add? There was someone who unmuted themselves, but I didn't notice who it was. Is there someone who wants to bring up a case or a situation?
Hi, Tim. Can you hear me?
Yeah, Jackie.
Hi, I'm sorry. I'm actually shopping, so I'm apologizing. I'm trying to go to a quiet space.
No problem.
Just one quick question.
Yeah.
Uncontrollable crying.
Yeah.
A lot of us, when they're triggered, it's very emotional for them.
Yes. Yeah.
You know, the uncontrollable crying. Sometimes I just want to see like where I could bring them back, because at that moment they might not be able to do those 3 steps. So I was just wondering what you would suggest for something like that.
Yeah, absolutely. So if someone's getting into a place of uncontrollable crying, that would, again, that's like a state of hyperarousal. That's a state where you're not necessarily processing things. But one of the issues is you don't know. Sometimes it's this catharsis that's a relief. If you know the person, if you've been talking to them, you might have a sense. The biggest question for me when someone is really crying deeply is this kind of good crying? Is this sort of releasing kind of catharsis? Or is this sort of a level, like, are they just sort of triggered and like not really processing things anymore? But either way, what I would do is just try to be open and present. I try to remind them, like, so it's totally fine with me for you to be crying. Like, I'm here. And I'd sort of get a sense of like, would it be helpful for me to remind them that we're not in that place anymore? You know, is that helpful? Because that sort of depends on how the crying got triggered. But so I might be like, so just, you know, you're on the phone with me, we're here together. And you know, it's, yeah, please, you feel free to let this out as much as you want to. The idea that from my perspective, healing trauma is about holding two things at the same time. It's about being able to be in touch with your pain and to be in touch with the care and compassion that's there for you, right? And you're holding both. So you need to let both be there and to be in touch with both. So that crying, you know, it might, so that's sort of a question, and we kind of have a sense. We'll learn from the user about like, did that feel out of control or did that feel really helpful? But in general, the advice that I would have is just sort of like, keep yourself as present and grounded as you can. It might make sense to be like, so we're on the phone right now and I'm here for you, and you can have whatever reaction you're having, and I'm here to support you. But make sure that they don't feel like you're trying to get them to stop crying. because that can be triggering for someone. And then Divine also mentioned to talk about someone who's living in a state of trauma. So when we talked about the difference between acute and chronic traumas, so you can have someone who's had a lot of chronic trauma in the past, and you can have someone who is currently being traumatized. And so finding safety is extremely important for someone who is being traumatized. And one thing that I think is really some interesting research that I want to bring up, Divine, to support what you're saying in terms of talking about people who are living in a state of trauma. There's a lot of research about sending a bunch of therapists into, you know, areas of natural disasters and things like that. And one thing that we found is that if something just happened, less than, basically, let's say if the trauma that we're talking about was happening less than 6 months ago, the thing that you want to be focused on is helping the person feel empowered, helping them feel like an agent of change, and helping them connect with sources of support and strength in their lives. That's number one. So whether it's someone who's living in a domestic violence situation, or whether it's someone who, you know, there was just a tidal wave or a hurricane in their area, if it's less than 6 months old, we want to be focused on helping them feel like they have agency, they have the ability to make change, and connecting them with their community, sort of act together to sort of change things in their lives, to take action, and helping that person feel that they have that ability. And, you know, get in touch with that. If a trauma is more than 6, especially more than 12 months old, then what you're trying to do is sort of create some separation from it. That was then, this is now. I was in a state of danger. I am now in a state I'm now in a state of relative safety. And kind of because of that, I can feel, I can allow myself to feel safe in a safe environment. And that's really what kind of a lot of people, when they want to talk about trauma, especially in peer counseling, what they're wanting to do is they're wanting to say, like, I used to be in a dangerous environment. I'm now in a safe environment, but I don't feel safe. And so it's about helping somebody to feel safe in a safe environment. If someone is currently in a dangerous environment, you're focused more on empowerment. Are there any other comments or questions there? Great. So we're just about out of time. So we're going to pick this up because I feel like this is like important stuff. And I'm going to post this to YouTube in the next, probably in less than 24 hours. Thanks for everybody for participating. And yeah, so we'll post this to YouTube soon. If you have questions, email or post them in the comments. And then we'll do a part 2 of this where we'll pick up on trauma. We'll go into more detail, and then we'll also look at psychosis. So thank you very much. And yeah, I hope that everybody has a great holiday.